Welcome back to our channel. I am Dr. Harikiran, board certified plastic surgeon, cosmetic surgeon and hair transplant surgeon. We are practicing hair transplant surgery from last 15 years and we have done more than 2000 successful hair transplants so far. We have clients from all over the globe. Today I am going to discuss a very important topic, and it concerns most of the people who is like to want to go ahead with the hair transplant surgery. Is injections are painful? Is how painful is a hair transplant surgery? And what are the new technologies available to reduce the pain? So, how painful it is? Let's say we generally calculate in terms of scoring. There is something called pain scoring. 0 is a least number where you don't have any pain. 10 is the highest pain you can take it. Ideally, most of the transplant procedure, you should not cross more than pain score should not cross more than 3 or 4. So usually it is a very bearable pain. Even then, people who are very sensitive towards pain, now there are new methods and technologies available to make the pain reduce or diminish it. One of the technologies are, we use tactile desensitization, that's called vibration devices, using a vibration devices by doing a tactile desensitization. So whenever we are injecting the needles, which are very thin, so we use 31 gauge needles which are almost equal to mosquito bite. So you can say that comparison is mosquito bite. Even that pain we try to distract the body by using vibration devices, so that the pain significantly, the pain mostly same, but the absorption by the brain will go significantly low. So the pain score usually with the vibration devices usually falls under 2. So you barely feel something is happening, some sharp object. Once there is anesthesia involved in place and injected, then the pain is going to come down. So this usually the pain process should not last more than 4 to 5 minutes in total. Second thing, other than vibration devices, second thing we use is cooling devices. So whenever we cool the body loses, try to lose the sensations there temporarily. So we use high cooling devices to cool the area before injecting the needle. Even this brings down a significantly lower perception of the pain. Cooling devices. Number 3, recently we started using no needle injections. This is called dermajet. Dermajet is something where there won't be any needle. People who are really frightened with the needles and who are really scared. So we don't want a needle at all. Even then we have a solution, something called dermajet. So we inject a local anesthesia through the skin without needle. So there is a high pressure devices which push the anesthesia solution into the skin without being injected by the needle. This is the most advanced safe device for the people who are really pain concerned. You can ask your surgeon asking for a dermajet injection. This is the latest most advice in our clinics for all the people who are actually concerned about the pain. So we use a dermajet injections along with the vibrational devices and cooling devices. With these 3 things, the pain is almost just doesn't cross 1. So grading is only 1. It is less than a mosquito bite. So people who are really going for transplant surgery, ask your surgeon, have either they use vibration devices for a desensitization of the pain, cooling devices, or transdermal drug penetration by dermajet without needle. So these 3 technologies, if you can use it, then we can significantly reduce the pain, so that you don't need to worry about the pain at all. So otherwise, hair transplant is a very safe procedure, a very easy procedure. Talk to your doctor regarding the methods they use to reduce the pain. If at all, if you are really concerned with the pain, and these 3 things you should know about, that these are rightly available with the most of the surgeons today. Thank you so much.